Hello students, today we're going to start doing the cat muscle dissection, and a couple of things that you need to know first. Number one, this instructional video is just a supplement. Keep in mind this is not going to supersede anything that your instructor tells you, and it's not going to substitute you actually doing the dissection. So as long as you understand that, we're ready to go. So number one, first thing that you're going to need is you're going to need your lab manual. Make sure that you have the cat dissection lab manual. It is perfectly fine if you have an electronic version of the cat lab manual. You can also have the paper version. That's fine. The use of either your laptop, your iPad, your tablet, your cell phone for all of that is fine. We also have computers in here that you can use. The other thing that you will need is going to be your lab handout. Please make sure that you have a lab handout. Some instructors prefer to give you these lab handouts. Some of the instructors will post this on Blackboard for you, which is also why we have computers in the classroom for you to use. Now, what you're going to need in your lab manual is going to be the full dissection, the origin, insertion, and action chart of the musculature of the cat, and your directions for where you're to look. What you need your lab handout for is going to be for the names of the muscles that you need. Not all of the muscles covered in your lab manual will be in your lab handout. We do not expect you to know every muscle in the book. So what we're going to need today is a handful of rubber bands, a pair of forceps, a blunt probe, and a pair of scissors. Make sure to get a brand new cat for dissection, a large dissection tray, a rubber mat, and a 5-gallon bucket for storage. As we did human bones in previous lessons, we're going to have to transition and think from the bipedal organization of the human to the quadrupedal organization of the cat, or the four-legged organization of the cat. So, some of those familiar terms like dorsal, ventral, cranial, posterior, caudal, all of those are a little different when it comes to the cat. Taking a look up here at this chart, you're going to have the dorsal surface and ventral surface. So dorsal is still referring to the back, ventral is still referring to the belly, but you'll notice they're in different orientation. We also have cranial, which is slightly different from how we used anterior surface before in the human, and caudal surface, which is referring to the posterior and tail end of the cat. Now, if we're sitting there and we're saying the cat should be in dorsal recumbency, we're talking about laying the cat on its back. If we're talking about the cat should be in a ventral recumbency, the cat should be laying on its belly. We're going to use those terms now in looking at some of the muscles that we're going to dissect for the cat. What we're going to need to do is have your lab handout and lab manual. You'll need both of these two items to get through this dissection, and you'll want to look at these as you're going through and looking at each different muscle. So one thing when you're dissecting the muscles, one way to help you find which muscle you're looking for is the origin, insertion, and action chart. So for the origin and insertion, you'll find out which muscle you're talking about from your lab handout list, and then you'll go and look it up on the actual table that has the origin, insertion, and actions listed. So for instance, if we look at the first muscle or muscle list on your lab handout, you'll see it's the muscles of the thorax, which are found right here in the cat, and the superficial muscles are listed as the pectoantebrachialis, the pectoralis major, pectoralis minor, and the xiphi humerales. So, starting with the first muscle, you'll look and it's the pecto antebrachialis. The origin is listed as the manubrium of the sternum. The insertion is the fascia of the forelimb, and the action is adducts the forelimb. That's going to mean pull the forelimb in towards the body line. So, the pecto antebrachialis, the manubrium of the sternum. If we draw our manubrium in, and then draw our sternum, remember that's all going to be found in the thorax. We're then going to say that the pecto antebrachialis will go from the manubrium out to the fascia of the forelimb. So as we look at that muscle, it's going to be a straight line across the top of the chest. The second muscle is the pectoralis major, from the manubrium of the sternum to the costal cartilages for the origin, and the greater tubercle of the humerus. So manubrium and the top part of the sternum and costal cartilages all the way out to the tubercle of the humerus. If we were to draw that, we have a muscle that goes in an upward and lateral direction. And you should be able to find that muscle on the cat. Now, the pectoralis minor is going to go from the sternum, so we're no longer talking about the manubrium, but we're just talking about the body of the sternum, to the proximal end of the humerus. Remembering that proximal end, if the humerus is out here, will be closer towards the body than further away. So from the sternum to the proximal end of the humerus would be a deeper V when it comes to looking at the superficial chest muscles. The final muscle that we're going to look at superficially on the thorax is the xiphi humerales. This word should seem slightly familiar because it is the origin is the xiphoid process of the sternum, and it goes to the proximal end of the humerus again. So for this muscle, we start off at the xiphoid process and move again all the way up to the proximal end of the humerus, making the deepest V. So hopefully that will help you if you're looking at the direction of all of the muscles. You should see the xiphi humerales, the deepest of the V, coming all the way from the bottom of the sternum or the most caudal edge of the sternum. If you want to take your finger and push on the actual xiphoid process, that should be the last spongy but hard spot that you feel when you're looking for this muscle. Deep V all the way to the proximal end of the humerus. The next muscle up, the pectoralis minor, which is going to be a larger muscle in area than the pectoralis major. Again, a deep V, but just cranial to the xiphi humerales. Next, you'll have the pectoralis major. It's a much smaller V in surface, but again, triangular shape, all the way to the top where you have the manubrium, and the the pecto antebrachialis, which goes directly across from the midline all the way out to the lateral surface of the body line and the proximal end of the humerus. So for another part of the body that I'm going to give you some quick tips on, a different way to think about it is going to be for the dorsal surface of the cat. So here you have the dorsal surface. Notice that means that the cat is then laying on the dissection tray face down. Now for this, you have the cranial aspect of the dorsum, and you have the caudal aspect of the dorsum. If you look at the list on your lab handout, the part that we're talking about are the muscles of the back and shoulder. So we're going to cover some of the superficial muscles, the first three, the clavotrapezius, the acromiotrapezius, and the spinotrapezius. Sorry about that. The latissimus dorsi, you'll see a little bit later. And know that the clavodeltoid, the acromiodeltoid, and the spinodeltoid will be touching the lateral aspect of the clavotrapezius, acromiotrapezius, and spinotrapezius in that order. So, starting off with the clavotrapezius. First thing I want you to see when you look at the cat is you're going to start talking about the origin and insertion again. Clavotrapezius, the origin is the occipital bone of the skull, right here, and the spine of cervical vertebrae. Remember that your cervical vertebrae are C1 through C7, found just here in the cervical region of the cat. So, we mark our occipital region, and we mark the spine of our cervical vertebrae. That is the area that we're talking about for the clavotrapezius. Now, if we go all the way with the clavotrapezius out to the clavicle, remember the clavicle is going to be on the ventral surface of the cat, so we're talking about a muscle that's going to be flat, triangular, and wraps around to the ventral surface. So we'll draw all of that. Just like that. The clavotrapezius. From there, we're going to talk about the acromiotrapezius. Acromiotrapezius originates at the spines of the cervical and thoracic vertebra and goes to the spine and acromion of the scapula. So here we already have the cervical vertebra. We'll draw in some of the thoracic spines of that vertebra. And that muscle will then go around to the scapula. So there's a broad trapezoid-like muscle that will be there from the spines all the way out to the scapula. And remember, it's the acromion of the scapula, so it is the acromiotrapezius. Okay? The last muscle in this series is the spinotrapezius. The spinotrapezius is going to be found from the spines of the thoracic vertebra to the spine of the scapula. Now, they're not being specific, just the spine of the scapula. And again, your scapula is about right there. You have the spine of the scapula. You're going to have a muscle that goes from spines of thoracic vertebra, and we'll draw that out because remember there are 12 thoracic vertebra, all the way out to the spine of the scapula. This is the last of those three muscles. Now, remember that clavo, meaning clavicle, acromio, meaning going out to the acromion of the scapula, and then spino, going from the vertebra all the way out to the spine of the scapula, will give you a clue as to what order they come in. Now, the other clue that I'll give you all for clavotrapezius, acromiotrapezius, and spinotrapezius, to remind you what order they come in, is the College of Arts and Sciences. Generally, if you're going to do a dissection in Anatomy and Physiology 1 here at Xavier University, you're doing it in the College of Arts and Sciences. That'll give you a little bit of a hint, other than the bones and the order that they're in, to which one comes first when you're going from the cranial to the caudal end.